Now he's getting really sedate from the midazolam. Took a couple of minutes, and he's sedate enough that he's starting to have trouble actually standing. And we're just going to let him sit down. Get his head stabilized and the vein extended.
You try not to induce really fast. You try to give your induction agent slowly.
And again, we're just having that up hind leg held out of the way.
That was a nice stick. Other than it looks like maybe I'm not in the vein. But the patient didn't move.
They have really thick skin, and I think some of these in these desert communities are a little dehydrated, so you get a lot of drag with the needle going through the skin. They're somewhat more difficult to find a vein and inject than horses are.
What I'm doing here is looking for someone to help me position the head because my Spanish isn't sufficient to explain to someone exactly what I need them to do to make the vein taut. When the vein is, you can see now that the head's positioned, I'm going to go ahead and give the sedation. With the vein relaxed at all or loose at all, the needle will just push it out of the way. If you get the vein taut, which is done through positioning, then you have venous access. Or venous access is possible and much easier. And I'm clearly thirsty. So anyway, that's what that was. I just was looking for an available person who I could say, hey, can you position the head for me? And now we're going to wait a few minutes for the sedation to take effect. So he's becoming sedate now, and as he starts to, I give midazolam directly after my xylazine because they don't tend to rouse out of the sedation that way. I don't have butorphanol in Mexico all the time, so I changed my protocol a little bit. He's getting unstable, ataxic, so I'm going to go ahead and induce him. Pull my needle out. I do leave my needle in between injections. I don't see any reason to stab them a second time if I don't need to. It's just going to stimulate them, and I try not to stimulate them once I have sedated them. And this is Mexican ketamine. I call it slow-acting ketamine. I think it's just at least 20% less concentrated than the ketamine here. The bottle says it's the same concentration. I wouldn't be surprised if it was 30% less concentrated, but it's at least 20% less concentrated, or it is actually slow-acting.
A little bit of struggling there, but the best thing to do is just wait and let it go away, and then they're fine.
That was a tetanus toxoid vaccine.
Normally we would do a figure 8 on the hock and foot and flex the leg for positioning for castration. We found that in small burros, sometimes they have trouble walking on that leg when they recover if you do that. So you can see he just held the leg up. We don't see in horses very much is lifting that up hind leg when they recover. Burros just do that. It's normal. It doesn't seem to cause any problem, and it doesn't indicate any pending recovery problems.